Good afternoon. I'm Yvonne Okwara Matole, and our sign language interpreter is Wilson Mushora. The Ministry of Health has announced 12 coronavirus-related deaths, the highest to be announced in a single day. Health CS Mutahi Kagwe says all the deaths are from Nairobi County, 9 from hospitals, and 3 who died at home. Kagwe called for stricter adherence to the containment measures, saying 65 patients were discharged, taking the total number of recoveries to 2,946.
With the last one, whether the numbers rising is a sign of more and more infections. That is actually what it is. It is actually more infections. That's why we are reporting them. It's higher and it's expected. As we said earlier, more than a month ago, we took a month ago when people were saying, Kenyans were demanding that we open the place up and we cease cessation of movement. A month ago, we said no, because we wanted to have 2 things happen. One of them is county preparedness, and the other one of them is counter preparedness, and the other one has to do with education of people, education of Kenyans, so that they understand the implication of what is going on, what they must do in order to protect themselves. Because the question is, if you lock up another 1 month and another 1 month, what is the additional asset you're adding to the country? Is another month and another month going to make Kenyans more and more aware? Which Kenyan is not aware now, who is going to be more aware in another 30 days? And I would like to imagine that there is a limit, there is a time that comes. And we said it, and we said we are going to have more increase, we are going to have increased cases, particularly if we don't take personal responsibility and protect ourselves.
Meanwhile, services at the PUMWANI Maternity Hospital have been disrupted following a go-slow by health workers there. The nurses say they cannot continue to work if they will not be provided with adequate personal protective equipment. At least 22 nurses at the hospital have been forced to go into quarantine after they tested positive for COVID-19. They say the management has not taken sufficient measures to protect them, including fumigating the hospital. The Ministry of Health has, however, dismissed claims that the health workers are working without protective gear.
When you have more than 10 nurses testing positive in an institution, that should be a worrying trend. If we are supposed to take care of the community that is coming to seek our services, we are the people now going to isolation, we are the people going to quarantine. Even by the virtue of us not closing the institution, then you coming to seek for a service, who will be there to offer that service?
And this also goes to the Ministry of Health and the national government in general, because what the counties or the facilities are doing, maybe they are getting it from the Ministry of Health. Let them come out and protect the health workers. So far we have had like 5 health workers who have died. There are 3 nurses, there is 1 doctor, and there is a clinical officer anesthetist also who died in Kakamega County. So we are saying that health workers' lives are at risk.
Dr. Doreen Adisa Lugaliki, who was the first doctor to succumb to COVID-19, has been laid to rest in her home in Ndalu, Bungoma County. The short ceremony was attended by a few family members and colleagues in the medical profession. Officials of the Practitioners Union who attended the burial called on the Ministry of Health to ensure health care workers are safe as they help battle the pandemic.
It just brings to light what COVID-19 is doing. It has caused so much devastation across the globe. And I'd like to appeal to Kenyans at this time that COVID-19 is real. So let's take utmost precaution against the disease.
2 KDF officers have been killed after a light Kenya Army aircraft crashed at Kithioko in Kitui County. The flight, which KDF spokesperson Zipporah Kioko says was a training flight, only had the 2 officers. Investigations are underway to establish the cause of the 11:30 a.m. crash of the Hughes 500 MD. Senators are holding a special sitting to thrash out an agreeable formula for revenue sharing amongst the counties. At stake is how to share $316 billion across the 47 counties. At least 21 senators drawn from the arid and semi-arid counties have protested the proposed formula for revenue allocation, saying it will further marginalize their areas. I want to take you there live now for a moment. Now, they were on a 30-minute break the last time we updated you on this story. They wanted to take a look at a couple of issues. They wanted to familiarize themselves with the report of the Finance Committee, and they also wanted to incorporate some amendments to that. They are back in session now. I believe that's Senator Johnson Sakaja representing Nairobi County speaking. Let's listen.
Honorable Senators, I would now like to propose the motion that the Senate do now adjourn. Honorable Senators, I have seen 10 interests already, and since we are not debating the formula, we are debating the reasons for adjourning, I would like to suggest that we take about 3 minutes each.
Preparing to adjourn that session. All right, let's take a look at what's happening in the Environment Ministry. There's a temporary reprieve for investors of Sun Valley 2, Sun Valley 3, and Royal Park Estate in Langata constituency. Now, they were facing eviction after their land was declared as illegally acquired by the Environment Ministry. This is after the Environment CS Keriako Tobiko agreed to a negotiated settlement between the government, the Environment Committee, and the investors on how the dispute can be resolved. Tobiko, however, insists the land was not legally acquired.
They have never been allocated. They don't own and have never owned any parcel of land within Ngong Road Forest, not just the anti-gazetted, in any part of the Ngong Road Forest. So the question then asks, how did it happen? How did that happen? And how many more companies or entities that are indicated as owning and they don't actually no. Nairobi prison land, if you may, Chairman and members, was land that was and still is part of the anti-gazetted forest area of Ngong Road Forest.
The Madaraka Express train that plies on the standard gauge railway resumed passenger services to Mombasa after restrictions to help tame the spread of the coronavirus disease were relaxed. The first train carried slightly over 500 passengers with regulations in place to reduce the passenger capacity. Afristar, a railway operation company which operates the train, said the safety of passengers and crew will be paramount during daily operations. Afristar said it has deployed 10 coaches, 8 for economy, 2 first class, to ferry passengers between Nairobi and Mombasa. 1 coach has been set aside to cater for suspected COVID-19 cases during the journey.
Tuweka mikakati kwamba kuna social distancing, kuna sanitizing, na kuna ile mipangilio ingine ya kumake sure that tickets zile wamenunua hawafanyi automatically. Lazima wapewe across the counter to make sure that hakuna ile kuinteract na watu. Wakikuja kwa lobby, kama vile unaona kuna social distancing, kila mtu anakaa kwa kiti yake, na kuendelea mbele mpaka kwa train. Wakiingia kule, make sure that 50% of the numbers are the ones that board the train. Kwa hivyo tumeweka mikakati yoyote ili kumake sure that wateja wetu wote wako sawa na kuna hii madhara ya COVID-19, hakuna ile interaction ya kuspread.
Mitumba traders in the country are now asking the government to put in place protocols to allow them resume importation of second-hand clothing as soon as possible, as their stocks are almost depleted. The traders say they are ready to fumigate the imported clothes at the point of origin and once they arrive in Kenya. The association says most of their members have closed their shops due to lack of stock. President Uhuru Kenyatta on Monday lifted the ban of the importation of mitumba clothes, but protocols on how to safely import them yet to be issued.
Kuna kitu inaitwangwa physical inspection ama inspection. That is one of the things that we'll continue doing. Fumigation at the country of origin. And we are also willing to do fumigation when the goods arrive here in Kenya, just to make sure that everybody remains safe. Yeah? Tena mnajua COVID-19 inaweza kaa kwa nguo for not more than 24 hours. And our clothes take more than 11 days to arrive in Kenya when it is placed on a ship. And actually, if we consider production, it is more than 60 days.
Nairobi Metropolitan Service Director General Mohammed Badi has repossessed a grabbed piece of land in High Ridge Parklands, which was initially a health dispensary. Badi, who toured the site where construction was ongoing in the company of area leaders, directed his officers to stop further development activities and close the site. The Director General added that the land will be reverted to its original use by constructing a Level 5 hospital in conjunction with the Ministry of Health to benefit the residents. The land was allegedly grabbed in 2007 when a health dispensary was demolished.
Any land that belongs to the county will go back. We cannot allow individuals to be greater than the state. That a hospital will be built here for the purpose which this land was intended. So if there is any person who has any dispute or thinks he or she has ownership of this land, then they can go to court.
That all public land should be repossessed and give it to the Nairobians, please. Even a lot of schools has been grabbed. Seriously.
When people around here have a medical issue, they have to travel all the way either to Mbakadi or Kenyatta, which is unfair and is also a demonstration of people operating under serious impunity